A recent report from the state's public education department reveals about 36% of high school students report persistent feelings of sadness or hopelessness. Alarmingly, about 18% report having seriously considered suicide. And for Clary Miller, this issue is a personal one.
So I am a suicide loss survivor. My husband died by suicide in 2008. And prior to that and since then, I have been a huge advocate for mental health and suicide reduction and prevention.
As part of that advocacy, Miller worked with Soraya Gallup at UNM's Project Echo. Project Echo has an effective model designed to teach anybody, anywhere through virtual learning. Together, they developed the Youth Suicide Prevention Echo program.
This project is one where we're working with educators to support the students that they may have around them who are struggling with mental health issues, maybe really worried, very anxious, and all of that kind of thing.
Often, it's an adult at school who recognizes a problem. It's often a teacher, school counselor, or a nurse who become the first line of intervention.
Everyone should have access to mental health care and feel comfortable reaching out. But we know for the most part that sometimes suicidal people will not reach out for help. And that's why we need to lean in and meet them where they are.
In the program, educators learn how to look for signs that a child or teen might hurt themselves, or worse, die by suicide. Specifically, they learn QPR: question, persuade, refer.
We ask the question, are you thinking of killing yourself? And then we want to persuade them to stay alive, right? And the refer, that's the tough part. We're underserved in New Mexico and across the country.
At the end of 6 one-hour trainings, participants are certified.
If someone sees this and they're interested in doing this training, we're delighted to have them, because QPR works when we have saturation, when there are a lot of lifeguards around. Think about the swimming pool. You want multiple people who can dive in and save, right? Because it's being in the right place at the right time for that one individual whose life that you could save or change.